The palpation point for the serratus anterior is in the mid-axillary line on the thorax, so it's kind of down here just on the trapezius muscle. Just a palpation right there. For the gravity-eliminated manual muscle test of the serratus anterior, the patient will be holding their arms straight out as if they're trying to punch the physical therapist, and the physical therapist will be holding the weight of the arm. And then you'll just instruct the patient to roll her shoulder forward and try and limit trunk rotation. We'll be manual muscle testing for the serratus anterior. For the serratus anterior, the patient will be positioned in a supine position on the table with the body fully on the table. The arm will be straight up, like you're punching the ceiling towards it, and then for the muscle of the serratus anterior, you're pretty much going to kind of punch the ceiling just using the shoulder to come up off, but the scapula is still going to stay planted on the table here. The weight of the trunk is going to be the stabilization of the patient, and then you're going to be resisting back down, so pushing the arm straight down to the table and just pushing right on that to test it.
Okay, so for the upper trap to palpate, you'll be palpating in between the inion and the AC of the shoulder, right along that muscle belly on top of your shoulder. Okay, so for gravity eliminated of the upper trap, you want to support underneath the shoulder and then also on the arm so that they aren't holding their own weight, and they'll just go into a shoulder shrug. Alright, I will be doing manual muscle testing for the upper trapezius. For this, you're going to use your stabilizing hand on the side of their head, and your resisting hand will be on the top of their shoulder. So they'll go into a shrug motion, and then what you're going to do is use your brake test and push downward. And that's how you perform.
The palpation point for this is going to be right in between your armpit line and your spine, right above the spine of the scapula. So while the patient is, their shoulder will be abducted to 90 degrees and their arm will be laterally rotated, so their thumb is pointing back. And for this, the patient will just move her arm horizontally, abducting it through the motion. We will be testing the middle trapezius for manual muscle testing right now. The patient position for this test against gravity is prone, lying on the table. The patient will stick her arm out fully extended and then point her thumb up towards the ceiling. To test this, you will push on the distal forearm just down towards into horizontal abduction, so just kind of push right here, and then that's testing it.
Okay, to palpate the lower fibers of the trapezius, you will just find the inferior angle and then move just medial to that. So for gravity eliminated for the lower trapezius, you'll have them starting down, and then you will support their limb through going up to 130 degrees or a Y position, and you'll support them all the way through it. Alright, we'll be doing manual muscle testing for the lower trapezius. So for this, they will be laying prone. Their shoulder will be in 130 degrees or in a Y position. and you'll stabilize on their scapula, and then you want to resist on their distal arm, and you will resist downwards in your right test. Right. And that's how you perform.
To palpate the rhomboids, you're going to want to find the medial border of the scapula, locate C7 and come down to T5, and that entire range is where the rhomboids would be palpated. To test the rhomboids in a gravity eliminated position, your patient's going to be in short sit with good posture, sitting up tall. Hand's going to be internally rotated behind their back so their hand is resting on their contralateral buttock. And what you will be doing is just resting your hand along the scapula as they're retracting, making sure they don't forward flex or rotate their torso. So we are manual muscle testing for the rhomboids major and minor. So we have the position set up to test against gravity. You're going to want the patient off the edge of the bed just so they have enough range of motion for their arm. So the patient's going to bring their arm back, leading with the elbow as if they're going into a rowing position. So at this point, their scapula is retracted. So we'll stabilize the scapula, and then you're resisting on the posterior aspect of the distal humerus, and you're trying to put them into scapular protraction.